Hello, ladies and gentlemen. I'm Tim Ulmer, and I welcome you to Epilepsy Gangster. It's very common today that, and always has been, that when people are taking medicine for epilepsy, it doesn't stop the seizures. And an alternative used to be just going in and cutting out a chunk of the brain and praying to God that you got the part of the brain that was affected. Now, they've been looking for less invasive measures, like for instance, my VNS, vagus nerve stimulator. Well, we've also got a doctor who's going to be talking to us today about a deep brain stimulator, which is inserted into the brain. And we'll meet the woman who's had successful treatment with it.
So I wanted to look at other non-pharmaceutical options because as technology's gone along, there's all RNS, VNS, DBS.
Also, we've got a neurosurgeon who's going to tell us about using a tiny laser to just go in and cut and kill the affected neurons. And we're going to have a doctor who is considering having this procedure done on him.
When I had a seizure in front of a patient in Tennessee, and the doctor who owned the office was there, there had to be something. There had to make a decision had to be made, and that was the straw that broke the camel's back, so to speak.
Thanks for joining us, and welcome to Epilepsy Gangster.
Epilepsy is an invisible disability. It can strike at the most unexpected moments, like the most devious gangster. Epilepsy is a criminal. The epilepsy gangster steals money from people. It doesn't matter if he steals it from college funds, whether it's from retirement plans, and some of his victims have to choose between spending money for food or spending it on medicine. The epilepsy gangster robs people of relationships and job opportunities. But most diabolical of all, the epilepsy gangster kills. Like all criminals, the epilepsy gangster must be stopped. Watch Tim Ulmer and his gang you're meeting, who are committed to ending the crime spree of the epilepsy gangster.
Ladies and gentlemen, you may recognize this face from the first season of Epilepsy Gangster, Gail Robinson. Gail was talking to us at the time about in the episode about not driving. But Gail is here today because she has gotten a new thing called a DBS. Now, Gail, hello, welcome to the show.
Great to be back. Great to make the round trip.
The round trip. Very good. Well, for the people who missed your appearance the first time, tell us a little bit about when the epilepsy gangster came into your life.
Well, for me, it was a big surprise because I had no history with any seizures at all. And one night I decided to stop sleeping and stop breathing at the same time. And that is when I had my first, what was known then as a grand mal seizure, and actually stopped breathing and woke up in the back of an ambulance. That's what they were called then. Actually, back of a fire truck with a bunch of really great people. And what turned into something that was simply, they thought was maybe, okay, you just stopped breathing once. Well, 3 months later happened again. And it was determined that it was a type of an epilepsy, but it was a seizure disorder. They thought if I just simply had a CPAP machine, that might make the difference. Well, it really didn't go that way. I also have, and I said slight end, I have the focal side. What would have been, I could look like I am just daydreaming, 1.5 to 2 minutes, and then it's gone.
Yeah.
So their temporal lobe, what would be called focal, over the years, and this has only been 14 years, out of nowhere. There was no brain trauma. There was nothing else that caused my problems. I'm in the 30% of I shouldn't be having seizures, but bingo, I got the gift.
What's been the biggest annoyances that the epilepsy gangsters put in front of your life?
The biggest thing, I think, is the medications that you have and the people that you want to be able to keep informed with your progress. For example, the neurologist, when you're working with a neurologist, and I would suggest for everyone, keeping your own data and going data directed to your physicians. So what I found in the beginning was going to someone, going with my data, and they would take a drug at a time, and then they would start low and go slow and run it up, and then max it out, go to number 2, run it up, go slow, run it up. And what I found was over time, we would go bam, 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 bam. And then I was basically sort of the guinea pig for those drugs on my body. Well, after a while, I said, you know what? We got to go to someplace else. We got to find some different folks that think differently like I do and be creative.
So where did you go then?
I went down to Emory because it's a level 4 epilepsy center. And I went and I researched the physicians that were there. I found someone that went and did their dissertation in the area of explorative types of pharmacology on the types of seizures that I had that were coming out of nowhere and were on the lighter end of things because they were focal, they were temporal. I might have one seizure a month. I might have 11 months in between seizures. And so what I found was the right person. He was also cute. I have to add that. Got to go for that too. He was also very data directed, and he wasn't intimidated by someone that came in, because I came in and said, here's what I have. Well, tell me about your seizures. I said, would you like to see one? And I pulled my phone out and said, take a look. The person who was with him was a student, and he goes, are they all like that? And he goes, no, this is good.
Did you actually have a video? Your husband took a video of you on your smartphone.
That's exactly right. I came with evidence of me having a seizure. I came with a spreadsheet. When, where, what triggered. Duration, length of time, all of those things, because I need to know, I have information he needs. I need him or her to know what I have. I need them to know what they have for me.
I'm amazed how many people don't keep journals or have not been told by a doctor to keep a journal.
You know what people do? They take more data and more information to research more for a car than they do for their brain.
And sometimes with their brain, they don't buy a good car.
That's right.
When did the guy pitch the DBS to you?
When I was doing my research in 22, I found that I was getting to the point that I thought, you know what? I have all these different medications. I have tried over 12. I'd gotten to number 14, and I called them the cocktails. Because if you do your research, you know that the first one, you'll have the maximum percentage of impact. You add a second, you'll have a disproportionate, maybe 5 to 15% impact from the second, and the third will have exponentially less. But they'll have some. Sometimes things will work well in a concert. However, I just said, you know what? I am now just crossed over the 60, but I also want to make sure all my parts work as long as possible because I'm a busy person and I have a long life to live. So I wanted to look at other non-pharmaceutical options because as technology's gone along, there's all RNS, VNS, DBS, which are all technological types of devices.
The reason we're using these is because of cognitive deficits that can occur with the surgical approaches, and these are ways to help us to avoid that. And so knowing a little bit about that, I think, can be helpful. And a lot of the field doesn't believe there are any cognitive deficits. A lot of surgeons think, oh, everybody's fine. Everybody gets better in time. And I think it's very important for people to know that that's not always the case and that people often have deficits. We should be taking a minimally invasive approach.
What kind of tests did you have to go through to see if you were fit?
When you're looking for a different type of approach, there's going to be an interview process because they want someone to understand this is actually a surgical procedure. And it's not going to be for everyone. Certain types of people that have a different kind of seizure, these are not going to be effective for. So there are only types of seizures that are going to be in the running for this to be a device that would be appropriate. So that's the first thing. The conversation has to occur first. Once you've been determined that you might be eligible to be considered for this, then the second step takes place. And then that conversation talks about, these are the process and procedures. First of all, they want to take a better, closer look at where things are occurring. They want to see what types of places are these located. Also, then going into the hospital itself and getting you when you're off the medications and getting a real clear view of where these things are at and what areas of the brain these are located as well.
And basically what you're doing, you're putting the electrodes through the skull, almost like a pin cushion. And the brain is made up of cells, billions of cells. They move around. As long as you don't penetrate a blood vessel and cause a bleed, which we're doing this with MRI, so you can, a good surgeon can see the blood vessels. All the brain can tolerate having these electrodes, put into it. Once they're in there, now you've gotten rid of you're in the brain. So if they have a seizure, you're more directly measuring it. So it's a really accurate way to do it. And then from there, we can also map function. So if and we've actually at Emory used those very same electrodes to destroy tissue. So again, you're probably not going to make too many people seizure free with it. But if we're deep in the brain and we find your seizure zone, we can actually ramp up the energy. Instead of stimulating the brain to disrupt function, we can ramp it up to where we can burn the tissue. Actually, at bedside, the person's awake. I can map them and test them while they're doing this. It doesn't hurt.
In my case, the ablation that I had hoped to have occurred was not good because what was determined, where we thought everything was more on the right temporal lobe, turned out that one thing was sneaking around over on the other side that we didn't see, but it was too close to the communication area. For that reason, I was a better case for the deep brain stimulus.
Okay, how's it been working since you got it?
The level of seizures have not only reduced, they're also only happened when it's very, very specific. If I don't sleep, and it was because my back was hurting and I didn't get a good night's sleep, that night at dinner, I faded out. I stayed up too late packing for a cruise. I got an hour and a half sleep. First night at dinner on the cruise, I faded out. Identical profile each time that I've had a seizure.
Are you still on medications?
I have reduced my medications by 50%.
Wow.
If you become seizure-free, at Emory, we like to wait 2 years before we change your meds. Now, that's not hard and fast. If somebody is they're on a whole bunch of medications and they're having side effects and things, we're probably going to change something quicker. We may not take you off of everything, but usually we try to keep you on what you were on before for 2 years. And I think that would apply if it's a surgery that's a destructive surgery, an open resection, a laser, or one of these stimulation devices. We still want to see you seizure-free. And then if you want to start coming off, we would wean you off of them and see how it goes. And if you're having auras or you start having seizures again, then we'll probably put you back on it.
Well, what final word of advice would you like to give people with epilepsy?
Data. The data is going to give you power because it keeps you from having to keep it remembered. It gives you something to say with paper for people that are used to reading it. It gives you something you don't have to remember, but it also gives you something that you have the actual information to share with those that is going to be important to. You've also got the data for more than one type of person that needs it, whether it's the physician, it could be the person if you have this type of procedure done, or you want to be considered for the procedure. You've got that information as well. You got it when you want to look at medications and you want to see if something's working. You don't have to go, well, I think it was, or I thought it was working or not.
Thank you very much for sharing all this with us, Gail. I'm glad this is working out good, and look forward to having you back for something else in the future.
Love to. Enjoy it always. You are doing a fabulous job, because we want to make the Epilepsy Gangster be something that we don't have to have anymore, and you could change your hat.
Hello, ladies and gentlemen. I'm Tim Ulmer. Between the last 2 seasons of Epilepsy Gangster, I had a wonderful milestone occur that was life-changing. I went 2 years without a seizure. All my life, since the age of 2, I've averaged a seizure every 3 weeks and probably been on over 30 medications. I have an epileptologist who keeps up on what's happening. And 2020, he put me on a new medication, and the frequency of seizures lengthened. He told me that if I could go 2 years seizure-free, he'd even improve me driving again. Well, it turned out that this spring, I drove myself to church for the first time in 33 years. It was a dream come true. Make sure your epileptologist keeps you informed on what's new in treatments and medications.
At SK Life Science, time is turning the idea of a healthy world into treatments of the future, one patient at a time, knowing that every second counts, as every moment is priceless, bringing new options to patients with epilepsy. And the vision of a world where 0 seizures is not just a hope for humanity, but a possibility to bring more to life.
Ladies and gentlemen, I am delighted to share with you one of the people who's known me longer than many other in my life. With me is Dr. Todd Diven, who met me when we were 12 years old at middle school in Potomac, Illinois, rinky-dink farm town. Todd, how you doing?
Fine, Tim. How are you, friend?
For the audience, we both knew of each other's epilepsy growing up, but situation never arose till we had to worry about it.
Well, I think at the time that we found out, when we were children, right? I mean, for me, it was probably 4th or 5th grade. Epilepsy Gangster really came into play as far as the seizures go at that age of about 9 or 10. At a later date, around 2018, I had an EMU done. Doctor came in. Based on some brain anatomy and EEGs results, he told me that the cause of it was probably from it started in the womb.
Todd, what's been the biggest intrusion of the Epilepsy Gangster on your life?
That can be a tough one to answer because it has affected so many perspectives of life. The biggest one I would say is the effect that it has on the profession that I had, podiatry, for about 20 years. And it had that effect because of the financial hit that it took up on that. If it's going to affect the finances of an individual, it also will affect everything that finance can touch. And so that goes into my schooling, my children, marriages. I'm married 3 times now. So it can have an effect on, it's kind of funny in some ways, and I'll share a little after maybe, but I had a seizure that lasted for about 20 minutes one time. That ended up in the ambulance, and the person sitting next to my wife asked your name, and asked me what is your wife's name, and I said Mary, and he looked at her and he says, "You're married, right?" And she said, "Wrong wife." So, so it's kind of funny, and they didn't say anything until she laughed, like you just did, and then the laughter kicked in. But the point here is, it can touch on it can changes so many parts of our lives that it's going to probably last for the rest of your life.
What's some of the treatments that you've done in the past?
Well, my seizure control has been handled with medications for, well, I'm 61, so it's been 50 years, 51 years or so. And it's been dealt with using Dilantin, Depakote, Keppra, Clobazam, and there's probably another one in there too. So probably about 5 or 6 medications have been used over the time. And there's always been seizures. Seizures for me started out with grand mal seizures at the beginning. When I first had the seizure at that age, when I started, I woke up, went to bed at home, woke up at Riley's Children's Hospital in Indianapolis. Now that at that time, they did what they needed to and what they could. So that the control was all with medication at that time, probably done as that way by most neurologists, and surgery wasn't the possibility, I don't think, too much then. With all the meds that they've had and the discussions I've had with doctors now, I wanted to try another medication because the seizures frequency for me has always been multiple seizures per month. Mm-hmm. And my seizures always have been, well, in the beginning, were nocturnal until 2011. And then I had my first seizure during waking hours I was in Baltimore at a residency program that I had gone back into. And that seizure was, I was standing up, the seizure came on, I couldn't talk. I was standing in front of a resident that was 1 year beyond me in the program. And of course, she was talking and asking questions, and I wasn't responding. There was no falling or collapsing, but the seizure was over. And when I said, "Doctor," she looked at me and said, "Todd, you just had a seizure." Not a good thing for a surgical residency program, but that's what happened.
What's the straw that broke the camel's back?
When I had a seizure in front of a patient in Tennessee, and the doctor who owned the office was there, there had to be something. There had to make a decision had to be made, and that was the straw that broke the camel's back, so to speak. And when I left that office, that was the end of my podiatry work, and it stopped there. From that point forward, I went on, and actually I sold Aflac insurance for, I think, 2.5 years. I tried that. I did not like that. It's tough, but to go from the level of being a physician in life, and then it's not to say anything about one level of doing one job versus another. It was just a point of making an income. A doctor told me, we were looking at an MRI one time, and the doctor, he's about the cerebellum. He looked at that and he told me, he says, "There's brain degradation." And with that word degradation, I stopped him in his tracks. I said, "Whoa, what's degrading here?" And so when he showed me on the MRI what that was, my question came out about what's causing it, or why is it happening? And then he said, "Dilantin." Tim, I took Dilantin for 35 years out of those 50 years. And when that happened to me, I had to make a decision. What am I going to do now about getting myself off of Dilantin, if I can do that, and still control the seizures?
Now, you've been named as a candidate for a special type of surgery. Please tell us what that is.
The surgery that they're wanting to do, whether or not they will, has not been decided yet. But they want to do, it's called laser interstitial thermal therapy.
The full name is laser interstitial thermal therapy. We don't shoot any lasers. We basically use the laser energy to hit the tissue and to get it to a certain degree of temperature when everything is basically being destroyed. Almost like you're making an omelet and you destroy the omelet. And you can get to 60 degrees Celsius to even 100 degrees Celsius if you want to. It's been done in what we call MRI suite, when it's an intraoperative MRI. The laser, it's like a very thin probe, can come from size of like 1.6 millimeter to even 3.3 or 3.4 millimeter. It goes to a specific target in the brain, and then the actual surgery starts when the patient is being scanned in the MRI and the surgeons see the evolution of the change in the temperature of the certain area that he wanted to ablate. The full package is actually being done in different steps, because in order for the surgeon to put the fiber in the right location, to avoid blood vessels, to avoid structures, you have a lot of planning before the surgery. So the planning is part of the surgery, but it's not being done in the OR itself. So the surgeon has a very detailed planning for how to put the fiber, exactly where to put it, which fiber to use, because we have different kind of fibers. And then the patient is coming to the OR. In some cases, it's been done in an OR that is dedicated with a machine, an MRI machine that can come to the OR itself. In some places, you have an operating room, you put the fiber in, or you put the bolt that will hold the fiber, and then you're going to another MRI, I would say room or suite, where you're going to do the actual procedure. The procedure itself is when the fiber is in place through a bolt that holds it in place, and then the surgeon basically sits in the MRI, I would say control room, looking on a screen, and decides exactly where to put the fiber, how much to ablate. If sometimes some of the fibers can be changed, so you can change the angle of the energy. So it's almost like hands-free, beside the fact that you put the fiber in place. The treatment itself will give you some degree of resolution the moment of surgery, but then it's a little bit ongoing. There is some effect on the tissue itself that we can see it over time, usually within the first 3 months. And hence the MRI from immediately after the procedure and the MRI 3 months after looks a little bit different. Some patients will have edema, which is like inflammation in the brain after the treatment, and hence a lot of time we give quite a bit of steroids to oppose this phenomenon.
What else do you have to experience before decisions made whether or not to proceed with the surgery? Tell us about that.
I'm quite comfortable with the idea of having this procedure done. And to answer your question, what are the risks of it? I'm concerned about memory loss because of the area of the brain that they're in. Thinking processes. How is that going to affect my thinking in the future after the procedure? Those are just ideas that I have or thoughts I have.
The risks are mainly from inserting the laser fiber. You need to make sure that you're not injuring any blood vessel, which that's what the surgeon will do, and that's part of the planning. Usually, laser ablation will not create hemorrhage, will not create injury to blood vessels, although yes, it can be done, but usually that will not be the case. There are some temporary changes that can happen to tissue around the ablation area, but those usually will go away. So this, I would say that altogether, that's a relatively safe procedure when done in a very experienced hands.
You told me there's psychological or some kind of psychological screening that's next. What's that test going to be like?
Well, that's going to go in and where they will, I think the test will probably take 30 minutes, an hour. I'm not 100% sure. Depends on what their questions are. We'll meet with them and they'll ask questions that will give them ideas of how I think. What's the thinking process of me? What's my thinking process? How has it affected me in the past? For example, has it caused depression? Has things happened in your life that has that relates to a depression if there has been. And in my case, there was depression. And I took antidepressant medication, and I haven't been taking it for about a year. So it's to look at the full picture of an individual's psychological status and see if they can come up with anything, because and studies they've had in the past is going to tell them how this person will handle surgery after we do it.
We certainly wish you all the best, that you get this test passed and get the surgery. Is there a word of advice you'd like to leave people with?
Stay resilient. Do your research and ask your questions. If I had one word, faith. Have your faith. Don't give up. That's it.
Amen. God bless you. And wish you all the best with this.
Thanks, Tim.
Ladies and gentlemen, Todd is, we're hoping that he'll follow up with us so you yourselves can have a chance to see how it's done for somebody. In the meantime, Todd, good luck to you. God bless.
Thanks, Tim.
The Defeating Epilepsy Foundation is a nonprofit organization dedicated to helping those battling epilepsy. We provide advocacy and educational services to those battling epilepsy at a global level. For more information about our projects and services, please visit our website at www.defeatingepilepsy.org or email us at info@defeatingepilepsy.org. Please like us on social media and follow us so you can see how we are making a difference. Thank you for your support, and together we will defeat epilepsy.
Hi, I am Natalie Beavers, and I am one of the many survivors living with epilepsy. My life has been filled with many ups and downs. It's just a part of life. I am proud of the person that I am becoming, and as I stand in the face of this relentless disorder called epilepsy, I want you all to know that I am me.
We can be inspired that epilepsy and dyslexia didn't limit this man's ambitions. His resilience, hard work, and a deep sense of purpose has made an impact not only in Hollywood, but around the world. He debuted in The Color Purple in 1985 with a powerful performance that showcased his ability to bring deep emotional complexity to his characters. He gained international fame as Sergeant Roger Murtaugh in Lethal Weapon, with an on-screen chemistry with Mel Gibson that turned it into a massively successful series. Besides action films, he was critically acclaimed in movies such as Mandela, Places in the Heart, To Sleep with Anger, and Beloved. Whether as an actor, producer, or director, his projects highlight underrepresented voices and important social issues. Topics like racial justice, human rights, and global inequality are the focus of his own production company, Lubator Films. His dedication to storytelling helped bring meaningful narratives to audiences worldwide, solidifying his role as both an artist and an advocate. His influence exceeds the entertainment industry. His passionate activism is with organizations like UNICEF, Amnesty International, and the Trans Africa Forum. He advocates for labor rights, economic justice, and healthcare access, using his platform to speak on behalf of marginalized communities. He's earned numerous awards for his humanitarian efforts that include the NAACP President's Award and the Jean Herschel Humanitarian Award. His name is Danny Glover. I tried to find hope in struggle and resistance in small places as much as I can.
Hey, Epilepsy Gangster, we are in a war. And it's a tough war to the finish, but my gang and researchers have got you in our bomb sites, and we are determined to get rid of you once and for all. And in the meantime, may the rest of you be seizure-free, and God bless you.